Carolina is launching a first of its kind in the nation effort to ease medical debt under which so many North Carolinians suffer. We've been given approval by the Center for Medicaid, Medicare to use federal health care access and stabilization payments, HASP payments. Many people in the medical arena know about that. We've been able to use those to incentivize hospitals to do the right thing and forgive medical debt for low to middle income people and avoid the creation of medical debt on them in the future.
Having access to health and what makes you healthy is a basic human right, and that we have to use every lever we have to go after making it easier for people to be healthy. No one chooses to go into medical debt. No one chooses to have cancer. They don't choose to have a heart attack. They don't choose to get in a car accident. And when they show up at the emergency room, they don't say, "Hold on a minute, what's the price?" Second, hospitals spend considerable time and energy chasing this debt with calls and letters and staff trying to get debt that, as Governor Cooper said, is never collected. Pennies on the dollar. And yet, with all of that activity yielding very little value, 67% of bankruptcies in this country are attributed to medical debt. This policy is the potential to treat this disease in our health system. It breaks this cycle of sickness where people face high costs and stuck in EDs by wiping away debt back to January 1st, 2014 for people up to 350% of the federal poverty limit. And looking forward, it allows hospitals to focus on their mission and what we know they care so deeply about, caring for their communities, by putting in place higher standards for charity care policies and better practices for debt collection for those parts of debt that do need to be collected, and a responsibility to get people enrolled in the charity care programs that they already have.
Good afternoon, everyone. My name is Jose Penabad, and I am a board member at Undo Medical Debt, and I'm also a fellow North Carolinian living here in Raleigh. Our organization is now celebrating its 10th anniversary, and we have worked to relieve over $13 billion in medical debt for over 8.6 million people in the United States, and we have touched every single state of the union. Soon, we are looking forward to working with our friends here in North Carolina to continue that mission as we also try to knock down $4 billion of debt in our great state. Our long-term goal is to work in partnership, in collaboration with the healthcare system, with patients, and with the government to really attack the root causes upstream that are causing medical debt that impact many of our friends, family, and neighbors. But as we look around today, what we see is a situation where many of our fellow Americans, and indeed our country, finds itself in a hole being dug by medical debt. And growing up, my parents taught me that the first rule about getting out of a hole is to stop digging. So that's what we're here to try to do today, is stop digging the hole. And with that, we'll talk a little bit about how Undo has worked with other hospitals and provider groups across the nation and why we think North Carolina's approach could really be successful. In the past, we've approached hospital groups and we have purchased medical debt from hospital groups and providers across the country, as I mentioned, typically for pennies on the dollar. And we are creating what we believe is a win-win situation, not just for the patient, but for the hospitals themselves. Our organization is buying debt that is truly economically worth nothing. It is uncollectible statistically, and it's been written off in most cases as an accounting write-off by the time we see it. So we're giving money to hospitals essentially for something that's worthless, and in turn, turning it around and forgiving debt for the people who owe it.
Great, thank you. Yes, sir.
You admit that. Yeah, I know.
Photobomb.